each other now. If any question from anyone, otherwise I think we can conclude. Again, thanks for the huge possibility chance that you gave us to be here. I don't know if Antonio want to add other things, Julia or Luca, if you want to add anything, or if there are any question from the digital office.
Oh, this is Dr. Tian from China. Thank you for your great presentation. So because it's very late in my time, so I want to make a quick comments to the TAPP for inguinal hernia repair.
Julia, it's for you. Okay.
Yes.
Oh, thanks. Oh, can I share my screen?
Yes. I don't know if the dealer's office can allow you. For us, yes. I have to go out. Sorry. Okay.
Thank you.
Okay. So see, I'm the boss. So see, I'm the boss.
Thank you so much. So I want to make quick comments. First, I just go through the this guideline, which published in last year, updated international hernia search guideline for growing hernia management. So in this guideline, here are the recommendation. In laparoscopic endoscopic repair, high weight mesh is recommended, especially in a large and direct hernia to reduce the risk of recurrence. Low weight mesh is not recommended as it does not reduce the risk of post-operative pain but increase the risk of recurrence. So the first comment is for a large and direct hernia. And the guideline recommend high weight mesh. And the second one is the fixation, because the presentation because fixation I think it's important, especially for large hernia. Non-fixation in direct and large defect hernia post higher risk of failure for light weight mesh with a 7-fold increase compared to high weight mesh. So the second comment is for the large hernia, as fixation is recommended for in TAPP.
Giulia, hai capito la domanda?
Thanks for the question. So about fixation, as I tell before, we fix the large hernia, but in our experience, in case of little hernia, if we put a larger mesh and we put well overlap, especially in the retroaxial space, and probably we have a less recurrence rate because we perform a lot of bilateral hernia, and during and we restart like a stop technique all the space, and we put the two mesh in overlap in the anterior in the retro space. So probably I think yes, we know the recommendation, but in our experience we are very happy to use this type of mesh because it's easy to put inside. And we think we discussed also with Dr. Cucleta about it in the last hour course. And we think that the most important thing probably is the larger of the mesh. So we have to put a very large mesh. And sometimes in TAPP, we think they put a little mesh, then almost 10 for 15 or also 15 for 50. You can cut the mesh according to the defect, to the type of the defect.
So use the large mesh.
Yes, yes, you use a very large mesh. The medial point is the more frequent size of recurrence. But we discussed also about fixation also with Cucleta, and after this discussion, we sometimes more than before use especially the glue. We don't use the tack because we think it's a closed space, because after you close the peritoneal space. So if you put two larger mesh with a good overlap, and just in big hernia, you can put a stitch to reduce bulging and to reduce the hole, and also you can use the same stitch to fix the mesh. We think it's enough, but we know that also, I think the use of mesh, it depends also if the hospital you can take and your experience you have. So I don't know if Ferdinando has some other comments about.
No. I think that Luca. I see that Luca and Antonia wants, just because the first line from me is Luca, Antonia. No? So Luca and then Antonia.
Yeah, thanks. What Julia said is also, I mean, supported by a paper published on mini-invasive surgery. If I can share the screen, I can share the paper with you.
Yeah. Juhonka, can you take out your screen?
Yeah, I just take out. I don't.
Okay.
Maybe this way. I don't know if.
Okay, so, now it's coming, Luca.
Okay. This paper was basically published on mini-invasive surgery by René Forteny, that said that the same of Julia. So it is supported also by our journal.
Okay. Antonia?
Yes, Luca introduced what I want to tell, because I'm completely agreed with Julia, and my suggestion is if you, in your mind and the colleague, you have the feeling to fix this, you can change, can be the technique, so you can perform TAP, because now this is, I think, known and 100%. What is really important in hernia, in good hands, is the pain, the chronic pain. The results in terms of recidives are the same. It's not, unfortunately, a technique that is superior from the others. So to tack, I have fear to take tech and meet pro tack. So change the technique if you have not the feeling that you are sure.
I agree. If I can resume, what is important is, first of all, the size of the mesh. And second, just because we have the same experience, me and Julia, we used to fix only about the direct mesh bigger than M3 according to European Hernia Society. But we always, if we have a huge defect, direct huge defect, we close this one. It means the transversalis. We make we close the transversalis. It's not undertation, because this one is going to what we call the sliding mesh, the bumping. You're going to avoid the bumping and the sliding mesh. And everyone agree, the bigger is the mesh, the less problem you're going to have. Then one thing is, I have done a lot of guidelines. Just remember, guidelines is a suggestion. It's not a Bible. And then you have not to read only the suggestion, the recommendation, but what push the writers to write this suggestion. And mainly the paper are not so evident, but the expert can say something. This doesn't mean that you have another experience that you can go on this experience. And again, our experience, I think, as Julia, as Luca and Antonia confirm this way. But we have, this is our way to face the problem, but ready, as told Luca, as told Antonia, to fix the mesh if needed. Not to use the takers for inguinal hernia repairs. Not to use the takers. Any other question?
course, thank you for all your wonderful presentations. And wholly appreciate your time and the wonderful insights for us. And we also have 3 other live stream platforms. So the record will be uploaded to our website and will update you the detailed statistics of the webinar, and we'll send you the certificate of speakers. And thank you all for today.
Thanks. Can I say thanks to all of you? Thanks, Luca. Perfect. Giulia, grazie, che ti devo dire. Antonia, sei sempre più bella. Lo dico in italiano così non mi capiscono. Thanks. And I hope in the future we can have other occasions like this one. I'm thinking about it. You know that, my mind is always... Ok. Ciao, grazie, and sorry for my delay. Ciao a tutti.
Bye.
Thank you so much.
Thank you.
Vi voglio
See you
bene.
soon.
Ciao.
Bye.
Grazie Ferdinando.
Ciao.